think when students come, they expect for you to teach them the technical skills. What do I need to know to be able to perform the duties of the profession that I've selected? But what they don't realize behind the scenes, specifically in health sciences, is just the responsibility that comes along with being a healthcare provider. And to do that, we have to strengthen their communication, their resiliency, their critical thinking, their ability to adapt, and we put them in situations where you have to work with the roommate that you don't like, or you have to do a group project even though you would rather do this by yourself.
Yeah.
Or yes, you are going to have to clearly communicate your needs face to face with me. And I think building those characteristics behind the scenes are things that they don't think about, but that is really what's going to make them stand out as a professional. I can teach them all day how to give the medications, but if you can't communicate, you can't call the pharmacy, you can't call the doctor, you can't recognize that something doesn't seem right, then that's going to negatively affect patient outcomes.
We talk a lot about preparing students for careers, but what does that really mean when the profession you're preparing for involves people's health, their well-being, and in many cases, their lives? At a time when healthcare demand is rising and the path into these professions is becoming more complex, we're taking a closer look at what it actually takes to prepare students, not just academically, but professionally. This is the Bulldog Mindset. Welcome to the Bulldog Mindset, a podcast about learning, leadership, and the academic experiences that shape life at Gardner-Webb University. I'm your host, Dr. Greg Pillar, Associate Provost for Academic Affairs, coming to you from the Gardner-Webb podcast studio inside the historic Elliott House in Boiling Springs, North Carolina. Today, we're focusing on the College of Health Sciences and the role it plays in preparing students for professions where the expectations are high and the impact is real. Because when we talk about healthcare education, we're not just talking about programs or pathways. We're talking about preparing professionals who will step into complex environments, make critical decisions, and serve patients and communities from day one. Joining me today is Dr. Tracy Arnold, Dean of the College of Health Sciences. Dr. Arnold brings a unique perspective to this role. As a 4-time graduate of Gardner-Webb and as someone who has moved from the clinical practice to faculty to leadership, now helping guide the direction of one of the university's most in-demand and fast-growing areas. Today, we'll talk about her path, the strength and growth of healthcare science programs, and how Gardner-Webb is responding to the increase in demand for healthcare professionals. We'll also explore the role of scholarship and student development, including events like Scholars Day and the experiences that help shape students not just academically, but professionally. Dr. Arnold, welcome to the Bulldog Mindset.
Thank you for the invitation.
Well, let's start with, many people may not know your role here at Gardner-Webb. I know that you are Dean, but can you talk a little bit about that position and what your day-to-day looks like?
Sure. So as Dean of the College of Health Sciences, I'm responsible for 4 academic programs: the Hunt School of Nursing, the Department of Physician Assistant Studies, the School of Psychological Science and Counselor Education, and the Department of Exercise Science. And really all those programs collectively keep me busy all day long, every day.
I can imagine.
Yes. There's lots of things going on with students, clinical placements, grants. That's a big thing that I'm working on right now. We have a $2.1 million HRSA grant that keeps us busy. Just faculty needs from day to day. There's always something going on, a piece of equipment that's not working. And so I'm just spend a lot of my time taking care of day-to-day needs and then networking. I meet with a lot of clinical partners, external agencies, and then dreaming big of things that we want to do in the future. So
well, and that's important. And we've talked with a couple of the other academic deans here on the podcast, and sometimes the day-to-day requires just taking care of the current fire that's going on, and you can get in the weeds and mired in that, but to be able to have the opportunity and for you to, say part of what your day-to-day is that forward-looking, forward visioning, that's important. And that's a healthy sign that you're running a well-oiled machine within the college. In the intro, I noted that you're a 4-time graduate of Gardner-Webb, which is unique. Can you talk a little bit about your pathway into your role where you're at right now as dean, and that journey starting with, as a student back pursuing your first program here.
Sure. So I came to Gardner-Webb straight out of high school in 2000. I knew I wanted to go to nursing school. And in seventh grade, I was introduced to Gardner-Webb University. I was, don't make fun of me for this, I was on a jump rope team and I was pretty good.
That's awesome.
Yeah. And so my coach at the time was a Gardner-Webb alumni. I think she was actually inducted into the Football Hall of Fame. And so he brought us back. I grew up in a little town called Sylva, North Carolina. And we performed at a halftime show at a basketball game. So that's how I first learned about Gardner-Webb. So when it was time to apply to school, I just knew that this was where I wanted to come. I stepped on campus and I just knew. So enrolled in nursing school, really had no idea what kind of program I was enrolling in. I didn't really understand what an associate's degree meant and that rolled into a bachelor's degree. So I came to Gardner-Webb, fell in love. I loved the faculty. I loved the campus. I tend to be an introvert, and so the campus just really fit my personality. It wasn't too big, but it was big enough and lots of things to do. And so I just came through the associate degree program. I had an incredible experience, incredible faculty. And when I graduated, I was 20 years old. I wasn't ready to go back home, and I was going to have a big girl job working at the hospital. So I worked at Caramont Health in Gastonia and stayed on to do my RN to BSN program. And I moved out into the apartments. And at the time, we didn't have like GW online. So the RN to BSN program was all face-to-face
on campus.
So I came every Monday from 8 in the morning till 10 o'clock at night. We got a break, 1 hour break for lunch and a 1 hour break for dinner. And otherwise we were in class all day. So I did that for 2 years, and I worked my 3 12-hour shifts at the hospital, and I lived in the apartments. And at the time, my fiance, now my husband, was here as a student. And then I got through that program, and then it rolled right into the master's. So I did my associate, my bachelor's, and my master's all back to back. And so that was a great experience. I loved being a student, and it was really the faculty that kept me here. I just felt at home. I felt like I was being successful as a student. I was growing professionally because I had some opportunities at the hospital to move up the ranks there. So that was just really exciting. And then I knew I wanted to get my doctorate, and they didn't have a program at the time. So I finished my master's in about 2006, and I knew they were talking about a doctoral program, and I just kept calling and waiting. I was looking at a PhD program at UNCG, but you had to go there every Friday and commute. And I really wasn't interested in that path. So I waited, and then they finally got it in 2010. So I was in the first cohort.
Oh, wow.
I was so
I didn't
excited.
realize that.
Yes. Yeah. And yeah, so that's kind of my experience, as a student.
Well, you noted a number of different programs within the College of Health Sciences, but with your background in nursing and that is not an area that I am from, but being in higher institutions that have had nursing programs, I'm familiar with, or I have become much more familiar and learned quite a bit about those programs. But when you mentioned going through it yourself, and correct me if I'm wrong, it's particularly once up until the point with at least the licensure. So that's typically associate programs, bachelor programs.
Mm-hmm.
That it's intense study because it's the breadth of knowledge, the depth of knowledge you need to have,
Mm-hmm.
not only coupled with the clinical experience and simulations that you do, compared to other majors where things can be a bit more scattered throughout the week or throughout even a day.
Mm-hmm.
That is not the case with nursing. But when you get the master's, right, though master's and doctorate, those ones are not that they're still not difficult and intense, but since you're not, at that point still trying to get through to become licensed,
Mm-hmm.
unless there's some additional licensure, I guess, that you're pursuing.
I guess for me, the associate degree program is the hardest program that I have ever done in my life. And I don't know that you could pay me enough amount of money to go through that again. It just really, students enrolled in pre-nursing or pre-licensure nursing programs, it just really is a difficult curriculum. But there's such a responsibility with taking care of people and being responsible for their outcome, following your gut and making a decision. Do I call? Do I intervene? So I think that's why those pre-licensure nursing specifically is so difficult. But even PA, PA is the same thing, and that's at the graduate level. And in the in nursing at the master's level, you have your nurse practitioners. They've been experienced nurses, but still they're the one making the call. They're not calling the doctor or the healthcare provider, how they were in a nursing role. Now they're the one that people are calling for advice. So I think every level of education is extremely difficult. And, it just depends on what your final role is going to be and what your final responsibility is. But for me, my master's was in nursing administration. So yes, that was much easier than the associate degree program. So,
well, and in many fields and degrees with our faculty, it's not uncommon for them to go straight through all their degrees right into higher ed academia. Mm-hmm. You mentioned working with in Caramount and the clinical experience, mm-hmm. And then you came into faculty and then now administration. I guess talk a little bit about how has the clinical and the nursing experiences that you've had shaped who you are both as a faculty member and then now as an administrator and dean.
Sure. So I worked at Caramount for 8 years before I entered higher education. So I started there as a new nurse grad. I worked in med-surg, moved up into critical care, and then I started my leadership journey at the hospital after I got my master's degree. And when I left Caramount, I was serving as a nurse manager of a 36-bed med-surg unit. I had about 75 female employees. And so I think all of those experiences really prepared me for leadership roles today. But I think it's great to have that experience of really what's it like in the real world, because we can teach students how to do things in the classrooms, in the labs, but until they do it on a real mm-hmm. person or until they're in a situation where they really have to pull back that information and use it, that's where it really all comes together. So I am so grateful for my time at Caramount. And there were a lot of mistakes that I made early in my leadership career there, because those were kind of my first leadership roles that I reflected on as I began my leadership journey here at Gardner-Webb, that, I can see just how much I've grown and, mistakes that I made early in my career just because I didn't know.
Greg, can I jump in with a question? Noel Manning here. Tracy, thanks for joining us. Really appreciate it. You talked about your journey to Gardner-Webb, where you wanted to go, but why nursing? What was it about nursing? You said early on you knew this is what you wanted to go into.
Well, it's interesting. I don't have an aha moment, but so growing up, I'm a first-gen college student. So growing up, my parents wanted just to make sure that I had a stable career with a decent salary. And so my dad, just was always like, you're going to be a nurse. And I'm like, okay, I will absolutely do that. Daddy's little girl. But, he knew some nurses and he knew the opportunities that were available. And so in high school, I took all the health occupation courses, and it's probably my junior year in high school, I volunteered at the hospital 40 hours a week for the entire summer. At that time, they called them candy stripers. But it was just, I was always just kind of told like that's what I was going to do. And I love people. I care deeply about people. So it lined up with my personality and it worked out for me. But I don't have a great, aha moment. It was just always ingrained in me that would be a wise career path.
Well, it's worked out for you.
It has worked out for me. And, parents know best. Yes.
Well, and that's a great segue into, looking more broadly at the work that you do in the College of Health Sciences. The fields that you mentioned, the departments that you mentioned, everything from exercise science, clinical mental health counseling, PA, nursing, those are all currently definitely fields that are in demand, and that demand is growing. Mm-hmm. Not to mention, and that they've always been complex, but the complexity of those have also continued to sort of shift and move. So with that in mind, why is this such an important moment right now? Not only to talk about healthcare education, healthcare development, but also in terms of how we view growing that field and I guess even maybe evolving it to meet the needs of today.
Mm-hmm. I think when you watch the news and you read the articles about what's going on in healthcare, what you're seeing is the shortage of healthcare providers. We need nurses, we need doctors, we need physician assistants, nurse practitioners, all of those individuals, physical therapists, mental health counselors. Mental health is such a big need right now. Chronic and rehabilitative services. We got aging population. So I think when you look at kind of all of those factors, and then you look at the programs that we have to offer, that we have a pathway to meet some of those needs. And exercise science, I mean, that is an incredible program. I have enjoyed learning about that program so much, just kind of the things that you don't really think about, all the rehabilitative and chronic illnesses that they manage, and then all the students that are going on to physical therapy school. I mean, that occupation itself just reaches so many patients from different facets, from athletes to, people with chronic illnesses. So that is definitely a trending field. We always need nurses. We always need physician assistants, nurse practitioners. There just are not providers out there, especially for rural and underserved populations. So I think our college is really leveraged itself to meet some of those demands. I stay in contact with, our local community partners, and they're telling us this is what we need, and we try to meet those demands.
In what you were just talking about, what I find interesting is, in many of the fields and the disciplines departments in your area are known as professional compared to, necessarily liberal arts. And part of that is that for some of those majors and programs, there's a clear and direct line from you're majoring in this. Here's what your job's going to be when you graduate. So nursing's a clear one.
Yes.
And PA is another one. However, I think one thing that often gets lost is, at the same time, though, you're not necessarily stuck in that, there's no room to shift or pivot. And by that, I don't mean it's not that someone's going to major in nursing, become a nurse, and then decide, I'm going to be a beekeeper. I mean, they might. That could happen. Nothing against beekeepers, but with exercise science, that was a good one that you just mentioned, where there's actually a range of of careers and paths someone can go with that degree. Can you talk a little bit about in terms of, yes, we're and how we prepare our students in any of those programs? Yes, they're ready and able to day one step into that clear job, but in general, just in terms of how we've prepared them to be able to adapt, to shift and pivot more broadly, whether most likely within health sciences, I guess they could go out of it, but may specifically focus on the health sciences.
Well, like you said, within all the disciplines, like specifically nursing, there are so many avenues. You do something for a year, you can go do a different specialty. You can work remotely. Now there's so many remote jobs, things like that. Telehealth is huge right now. You can work in the hospital, you can work in a clinic, a doctor's office, the school, all kinds of things that you can do. You can work with insurance companies, home health, those types of things. So with nursing, I mean, if you can get your nursing degree, the sky's the limit on what you can do. And then when you get tired of the clinical world, you can move into academics. And I mean, if you think about me, when I came into academics, I was a faculty member for 5 years before I got my first leadership role. So then I was a coordinator, then I was a program chair. And then at the time, nursing had dean role. So I was an associate dean, and then I was a dean of nursing. Then I moved up to the college level. I was associate dean of the college, and now I'm dean of the college. So even within academics, if you're willing to spread your wings and learn more, there's so many things that you can do. With exercise science, what has been just, like I said earlier, so interesting is just really the different things that they can do. A lot of times when you think about exercise science, you think about working at the gym or training athletes. And we do have a lot of great alumni that have gone on to work with professional teams and done high-level internships. Miami Soccer Club, Carolina Panthers. We have students that are working with those organizations. We have a student this summer that's working with Hendrick Motorsports. And so a lot of like high level opportunities for them. But then, if they want to go in the hospital and work in a cardiac rehab, those are opportunities. I mentioned physical therapy. Last year, we had 20 students from our graduates last year that got into physical therapy school.
Wow.
So, that's incredible. A lot of times, when you have a physical therapist, their goal was to create their own business, open their own clinic. So, just like lots of independent opportunities to be a business owner in the future.
Well, and with what you're bringing up and noting, there's opportunity for interdisciplinary collaboration. Mm-hmm. So, business was one that you mentioned. With not only pursuing nursing, but pursuing additional coursework and perhaps even credentials in business, so that you could someday either start your own business or something like that. Or you mentioned with even with sports management as well. And we've had the opportunity to have Dr. Ahern on the podcast, and I remember him talking particularly about where some of the alums have gone to professional soccer and the Panthers, and those are obviously great stories. But it also, again, it gets to the comprehensive education that students get, whether it's a professional program or something outside of it. Well, that leads us to a segment that we like to do called the hidden curriculum. And this is where we get at learning some of the aspects about college life, or even within programs that are not necessarily obvious. They're not on the syllabus. They're not on a policy statement. They're not on the clinical checklist. So with your perspective in the health sciences in particular, what is something that is perhaps part of that hidden curriculum for students pursuing any particular health science program that may not be obviously known, but either during their time as a student is critical for their development and success, or something that they may encounter as soon as they graduate?
I think when students come, they expect for you to teach them the technical skills. What do I need to know to be able to perform the duties of the profession that I've selected? But what they don't realize behind the scenes, specifically in health sciences, is just the responsibility that comes along with being a healthcare provider. And to do that, we have to strengthen their communication, their resiliency, their critical thinking, their ability to adapt. And we put them in situations where, you have to work with the roommate that you don't like, or you have to do a group project even though you would rather do this by yourself. Yeah. Or yes, you are going to have to clearly communicate your needs face to face with me. And I think building those characteristics behind the scenes are things that they don't think about, but that is really what's going to make them stand out as a professional. I can teach them all day how to give the medications, but if you can't communicate, you can't call the pharmacy, you can't call the doctor, you can't recognize that something doesn't seem right, then that's going to negatively affect patient outcomes.
See, and the challenge there is, some of those skills definitely come in the pre-nursing, like in nursing, those pre-courses that they take, their first couple of years. But I'm assuming though that some of that stuff continues to be sort of tested and or strengthened in the nursing classes as well. Even though there's lots of opportunity at the liberal arts institution and other courses, but that's something no doubt that you probably need to do throughout the entire curriculum. Yeah.
Even at the doctoral level, you have, you've already, let's say you have your associate, your bachelor's and your master's. We're still talking about communication at the doctoral level, because when you get your doctoral degree, that's kind of like you're being recognized as kind of like an expert in your field. You've reached that terminal level. And so just even how you communicate, that's completely different than how I taught you how to communicate as an associate degree nurse.
Yeah.
So I think all of those skills just kind of evolve with your education, and they mean different things, and there's a greater responsibility too that comes along, as you advance your education and advance your skills.
Well, I think that's great for the future nurses and physician assistants listening. That one of the best things they can do before they even step foot here is work on those skills in high school or before they get here, and then you'll be a step ahead. Well, we'll make sure you get more practice here, but you'll be a step ahead. Well, we're going to take a quick break. When we come back, we'll continue to dig a little bit deeper into understanding where the health sciences are going, the growth in health sciences, as well as talking about some interesting opportunities that our students here have with Scholars Day. So much more to come.
Biology is the key to understanding the world around us, from the tiniest cells to entire ecosystems. At Gardner-Webb University, our Bachelor of Science in Biology helps you to turn your curiosity into a career. With a focus on hands-on learning, small class sizes, and faculty mentorship, this program is designed to give you the skills you need to succeed. In our leading-edge labs, you can conduct research using advanced equipment and technology, gaining experience typically reserved for graduate students. Beyond the lab, you can step into the field through internships, research, and immersive learning experiences. You'll also have the opportunity to attend and even present at national conferences, network with industry professionals, and collaborate on real-world research projects. Gardner-Webb students leave prepared and confident to change the world through science. Many of our graduates move on to medical, dental, and veterinary schools, while others pursue careers in biotech, research, forensic science, and environmental sustainability. If you're passionate about science, discovery, and making an impact, Gardner-Webb's biology program is ready to equip you for the future. Take the first step at gardner-webb.edu/biology.
Welcome back to the Bulldog Mindset, a podcast about learning, leadership, and the academic life of Gardner-Webb University. I'm your host, Dr. Greg Pillar, Associate Provost for Academic Affairs, coming to you from the Gardner-Webb Podcast Studio inside Elliott House here in the Boiling Springs campus of Gardner-Webb. Today, I'm joined by Dr. Tracy Arnold, Dean of the College of Health Sciences. Before the break, we talked about her path, her leadership journey, and the idea of hitting curriculum and the parts of the experience that really shape how students develop as professionals. Now I want to build on that. We're going to turn to talking about the programs themselves and the growth that we're seeing in healthcare sciences. So, Dr. Arnold, we continue to see strong demand. You've mentioned it earlier for programs across health sciences. What's driving that demand, and how is Gardner-Webb responding?
Sure. So we talked a little bit about right now we're seeing the aging population, needs for rehabilitative and chronic care needs, preventative care services in the community, lots of mental health services. So we have a lot of programs that are really addressing those needs. We're current in our evidence-based practice. The PA program specifically has a mission for serving underserved populations in rural communities, which fits perfect into our landscape here. And that is just such a need. There are so many people in rural communities that just don't have access to healthcare. So that's their mission, and they're very passionate about that, and they do a lot of things with students to prepare them to serve in those communities. Mental health, we talked about that earlier. That is just a huge need, and we have our psychiatric mental health nurse practitioner program and our clinical mental health counseling program that are both putting out providers in that field. And then we were blessed with the $2.1 million HRSA grant that's actually providing stipends for students. So students are getting, psych mental health is getting $32,000, and clinical mental health students get $25,000 to help in that last year of study just to prepare them. And they can use the money for whatever they want: tuition, rent, daycare, travel expenses, whatever they need to help them get through the program so that they can go out and serve those communities. So I do think we've done a great job aligning our programs with, the needs that are out there right now.
You talked a little bit about the HRSA grant. Can you give our listeners a little bit of an understanding just in general what the grant is, and at the risk of, I know you might be repeating a little bit, but what the grant is and what we hope to accomplish with it.
Sure. So it's a behavioral health workforce grant put out through HRSA. We were one of, I believe, 104, 105 awards received across the nation. But basically, it is to get mental health providers out there, put them in high-impact clinical experiences, make clinical partnerships, get them out in rural community, do integrated health. So where we kind of have this interprofessional collaboration where they're working with other disciplines to make sure patients get the resources they need, and how it directly really benefits Gardner-Webb and our students is that we give them financial support to be able to do this. We have some faculty assigned with the grant, and they're doing a lot of professional development opportunities, getting some certifications, and they'll be offering a lot of continuing education to the students, to our preceptors, to the community, people that are interested in learning about things like mental health first aid or telemental health. They'll be offering all kinds of different workshops. We're going to be launching 6 webinars a year that people can watch for free and get CEUs, and we've got them all credentialed. So it's a big operation, but it's most exciting that it's helping our students, and it takes a little bit of burden off of them financially so that they can be prepared to go out and do great things.
So, with those programs, and things like the HRSA grant helping to further strengthen it and allow them to continue to grow and expand, not only in terms of the nature of what they're educating and preparing students for, but also just the range of students that we're able to serve. Where are some other areas that you see of potential growth for the College of Health Sciences?
Sure. So I told you earlier, I like to dream. That's part of my day to day. Like, well, what could be? So we are always throwing around ideas, but 3 that we're kind of brainstorming right now. So this is in the early, just brainstorming. How can we do this? Physical therapy is my pie in the sky, and if you've mentioned that you have interviewed Dr. Ahern before, but Dr. Ahern, Dr. Hartman, Dr. Gaffney, I mean, they are just some incredibly talented faculty, and they teach at such a high, rigorous level that when our students leave here, they're a semester ahead when they go to physical therapy.
I've heard that.
Yeah. They are just incredible. Sometimes I listen to them talk and I'm like, I don't even understand what they're talking about. It is so far above my head. They are just so intelligent. But what really struck me, so I've been in either the interim role or the full-time role for a year now. So what really struck me as I've learned more about the program and talking to Dr. Ahern is that, and I mentioned this earlier, last year of our graduates, 20 of them went on to physical therapy school.
That's
got
phenomenal.
in the first time. And these students love these faculty. I mean, they're calling back. They're calling back, telling them, you prepared me so well. I'm a semester ahead, and they stay in contact. So when I see that, if we could keep those students here at Gardner-Webb, and Dr. Ahern and Dr. Gaffney are both physical therapists. So we have 2 physical therapists on staff. So the bones are there. I think the heart is there. There's just all the logistical stuff, but that's my pie in the sky dream. And it's going to take some time, but that's really what I'm aiming for. Also with nursing, several years ago, when we started the accelerated BSN program, that was really an up-and-coming program to replace the associate degree in nursing program, because we knew that program would eventually phase out because of the competition with the community colleges. And so we started the accelerated BSN program, and that's really for individuals that have a bachelor's in any other field, but they want to come and be a nurse.
They want to pivot into nursing.
That's right. So 16 months and you can have your bachelor's degree. Well, really, the next thing we're kind of talking about is, all right, these people already have a bachelor's degree. So there's some challenges with financial aid and things like that. Why don't we elevate them to coming out with a master's degree? Because when you do your education, you really should always try to, move up and not, have a similar, I can't think of what the word they call it, but like sidestep.
Yeah.
Try to move up if you can. So there are some direct entry Masters of Science in Nursing programs. They don't specialize like in nursing administration or nursing education. It's just a generic. But we're looking at transitioning that program into a master's level, which really will open up some opportunities for financial aid, because now they can get that for a graduate degree, and they'll have, a master's instead of a second bachelor's degree.
And so they would become licensed during that process.
Yes.
Especially, because they're coming with a bachelor's, not in nursing.
Mm-hmm.
That's when they would become licensed. Interesting.
Yeah. So there's a couple programs in North Carolina. So it's kind of the newest merging thing. There, like with every new program, there's some challenges with it, but I do think it would open up a new opportunity for students. And then my third one, this one is really exciting too, is the university doesn't have a PhD program. So I would love to do a PhD in counselor education. So a lot of those faculty in that program have PhDs. It's not needed to work in clinical practice. The master's degree is sufficient, but for education, if you want to teach, you do have to have the doctoral degree. So I've got them working on a little proposal to see. But so those are my three.
Those are three great. That's a great vision pathway.
Yeah, so it's exciting, and I'm ready to do them all.
You ready to do them all?
So Dr.
Love
Walters
it.
and President Evans, I need some money, please.
Okay, we'll we'll help move that forward. Absolutely. No, and those are three great areas. And one of the things I want to come back to briefly with the PA program, that's impressive and should definitely be mentioned. And this is the case sometimes too, whether it's a physical therapy program that you mentioned. And this is the case whether, students are pursuing, going from their undergrad into a medical school or things like that. Schools will often tout, high acceptance rates, and that's important. But you had briefly mentioned it, but these students were also getting in on their first attempt. And some of these fields are ones where it's very common to take 2 or even 3 attempts before you get in. And in between, you're doing your best to continue to strengthen your case, your candidacy. But that's very common. But to have those students accepted on their first, that gets back to, as you mentioned, the preparation, and not a surprise that then they're like a semester ahead. If they're that strong, they would have no problem.
Yeah. Well, and with physical therapy, I believe there's only about 10 programs in North Carolina. So
limited.
It's a small pool of schools to choose from if you're choosing to stay in North Carolina and you're still getting in on your first attempt. So, I mean, it just speaks to the work that they have done to prepare their students.
Well, and then those fields are very competitive, so they're getting in.
Yes.
Well, and you can speak a little bit too, like for our PA program. It's very common, typically, unlike some fields or even disciplines where there really is no cap on how many students you can bring in. When it comes to accreditation and stuff like that, and just even the realities of physical space that an institution, their program have, there is a limit on how many students you can accept. And so my understanding too is the PA program is one that's always highly competitive.
PA is highly competitive. I've learned a lot about that program in the last year as well. They get about 500 to 600 applications.
Wow.
I think they've had as many as 700 at a time. So how PA kind of applications work is there's a portal. And so students all across the United States apply to this portal, and the portal funnels the applications out to the schools. But I've heard Director Kernicki say that, it may take 2 or 3 years to get into PA school. It is very rare to get in on your first attempt. And if you've ever been involved in the interview process for getting into PA school, it is intense because the curriculum is so rigorous. And so they really put potential applicants through a strong interview process, tons of interviews, critical thinking exercises, personality evaluations, just to make sure that they can handle the stress of PA school. And they have a very strict accrediting body. ARC-PA has some very clear guidelines, and we're, as faculty, we're held responsible for student attrition and student success and providing resources and making sure that when students enter your program that they are going to be successful. So there's a lot of things that go on behind the scenes that a lot of times students, they might not be up to date with all the accreditation nuances and things that we're all familiar with that really kind of go into developing programs. And then, you also have to have faculty to teach.
Yeah.
And it's very challenging to find faculty that want to transition from clinical to academic. So
and that's the case in a number of professional areas where it can be very difficult, to persuade people to come into the academic space. And in some cases, and this is a huge benefit and resource to the program. You get people who are doing both. They're still active in their practice as well as teaching, and so those practitioners are important. But with the competition for the PA program, as you mentioned, that's where too in the Carolinas we've seen a lot more schools add PA programs, which is not an easy thing to do.
It's not. ARC-PA is very protective of adding PA programs. So I think maybe there's about 13-ish in North Carolina, but they do protect the programs by saying if you have to have the resources to be able to do
that. Well, and that's where even with some of these, I think Elon is one of the more recent schools to come on board with adding PA. But back to the point of the classes they can enroll are capped, the cohorts. So even with all that, even with a few new schools here and there, it's still difficult. Let's pivot a little bit, and let's we've talked quite a bit about clearly the training for these different professions, whether it's nursing, PA, clinical mental health, and so folks can clearly have an understanding or even in their own mind of knowing, likely because they've interacted with these professionals, what that training involves. But let's talk to a little bit about some things that may not be as well known in that process, and specifically where I want to get to is talking a little bit about Scholars Day and the role of scholarship and how we prepare our students, whether it's a graduate program like PA, physician's assistant, or it's even in the undergrad program. Recently, we had our Scholars Day, so if you wouldn't mind, talk a little bit about what that is, and then we'll get into the benefits of pursuing scholarship for students.
Sure. So the College of Health Sciences has had a long history of hosting Scholars Day. So usually what we do is bring together students from the different programs for them to share their research that they've done. Maybe they've done a literature review. Maybe they've actually done a research project. And so we set up, it's a day-long event. We have exercise science students make research posters. A lot of them are involved in, as part of their curriculum, they have to take a research class. So they do pilot studies and design exercise science or exercise programs for patients, things like that. And so they get to present their work. And then at the end of the day, we have our physician assistant students. They've all been enrolled in an evidence-based medicine course in different components throughout their study. And so they've done a big literature review on what does the evidence say about this particular treatment plan, or they'll compare medications, compare treatment plans. And so it's really a great opportunity, one, for them to dig into what the evidence says, because when we talk about health sciences, the evidence matters, and that really directs what we do as providers. So it gives them an opportunity to do that, but it also gives them an opportunity to build like problem solving, inquiry skills, and understanding why the decisions are being made to take care of patients. That's really what we want to teach them. Like, why does this medication matter? Why does this treatment regimen matter? Why does this exercise program matter? Not just to do it because it's robotic, but to understand the science behind it. So it gives them an opportunity to present their research. Hunt School of Nursing, all of our D&P students, they have all done quality improvement projects. So by Scholars Day, they have already met and done a live presentation with their stakeholders in their setting wherever they completed their project. And then the School of Psychological Science and Counselor Education, they have their own symposium on a different day where they are presenting research. And we actually just had 2 students travel with 2 faculty down to New Orleans, and they presented some of the research they had done. So there's lots of things going on, but I think at the end of the day, it's teaching them about evidence-based practice. What does the evidence say, and how does that inform the decisions that you're making with your patients?
Well, and that is so important today, especially in this world where we're inundated with information and stuff like that. And you've got so many people whose doctor is WebMD or Google, which at one point in time wasn't even that. It was still searching, but now with the AI tools that has, now you have Dr. AI, feeding into that, and so that doesn't make their job, even though they're coming from this evidence-based experience and work, and as they're working with their, patients. But I can definitely see from what you're describing the importance of these students, whether it's at the undergrad or grad level, engaging in scholarly work, research, as well as presenting it, because of some of what we talked about earlier, these other skills that are critical, the soft skills in there. Even though, in their day-to-day lives as a physician or as a nurse, they may not be doing research or anything like that, still with how they interact with patients and how they go about what they're doing.
Mm-hmm.
Those skills are critical.
That's right. That's right. And it really, when they have the opportunity to participate in scholarship, it really builds their confidence. And, they'll have their technical skills, they'll have their confidence. Now they know how to, look at the evidence. And that is really what's going to shape them in the future, because we want them to be, high-level thinkers, critical thinkers, but we also want them to be forward-thinking. And I think those are the skills that kind of take them out of this is just my technical day-to-day job, and that's how we build future leaders.
So as our time starts winding down, it's amazing how fast 30 minutes, 40 minutes just swim right by you. I'm very curious, especially with your wealth of experience and knowledge, for a new student coming into any of the Gardner-Webb Health Science programs. What is one piece of advice that you would give them? What would be, or maybe just the first piece of advice that you would give them as they start their studies?
I would probably tell them, don't be afraid to do hard things.
Love that.
Step outside of your comfort zone. You can prepare yourself. If you get asked to do something that you're not comfortable with, prepare for it and practice, and then surround yourself with incredible mentors. The reason I'm sitting where I am today is because I wasn't afraid to do hard things. And I surrounded myself with people that poured into me. I mean, I'm a direct reflection of a specific individual who just really cultivated me and was a good role model. And I think, that would be great advice to anybody that wants to do something different.
No, that's and that's something where, even with how, critical, fields like nursing, physician's assistants, and those are clinical mental health and what's at stake. Still, when you're pursuing that education, that's perhaps, the one time where you do have a bit of a true safety net.
Mm-hmm.
So when I say fail or make a mistake, I don't mean in a critical sense of, critical detail for a patient, but just in general with the path or things that you're doing, you're not going to have any other time to rebound as easily as you will when you're at college. So
Mm-hmm.
I love that with, don't be afraid to do difficult things. Well, a couple questions that I'd like to ask all of our guests. When you think about your role at Gardner-Webb and the impact, what impact do you most hope to leave on your students and as dean, I'll say it, and on your faculty?
What I try to do is recognize potential in people, potential in students, what they can be, what they can do, in my faculty, where they can go, how they can grow. So I'm always looking for potential in people. And then I try to see how I can provide the resources, the mentorship to help grow their confidence and let them, do the things that they want to accomplish. As a leader, I've trained my replacement. I can already see, people that could be sitting in my seat one day. And I, have told faculty, you're going to be this one day. You're going to take my job one day. And that doesn't scare me. That's exciting to me. We shouldn't, as leaders, be keepers of knowledge. So if somebody wants to know, like, how can I do this? What path? I'm an open book. So, but I just hope in the end, people realize that I'm their advocate. That's the word that I love to associate with leadership. If there's one word, I'm an advocate. I'm an advocate for the students. I'm an advocate for the faculty. I'm an advocate for the staff. What do you need to be successful? I want to make sure they have the time and the resources to do whatever they want to do to be successful.
Love that. And that just goes to show just, also too, I would say in my time working with you, I can attest to this, just how humble you are and how you approach the work that you do. And, so not only in terms of just the impact you leave on people, but as you mentioned, fostering that next generation of leaders to carry on. If you could go back and speak to yourself as a college student, what is one piece of advice that you would give yourself, thinking back to that pre-Dr. Arnold, first day in that associate's program? What would you tell her?
I probably personally would have. I was so incredibly shy, just so introverted, but just surround myself with people and building my confidence, and still going back to that, don't be afraid to do hard things. Step out of your comfort zone. I kind of kept my head down, did what I was supposed to do. Every day going to clinical was a struggle, knocking on the patient's door. I mean, that was terrifying to me. I didn't have the communication skills, at that point in my life. So it's really kind of the things that have shaped me now. I just wish I would have done them sooner.
Well, the final question I'll give to you is open mic. Any final thoughts or anything you'd like to share with our listeners?
Sure. Health sciences, it's a huge responsibility. You have what you do directly impacts lives, and I don't take that lightly. And so, we have high standards, high expectations, because at the end of the day, your decision can mean the matter of life and death. But it's a great, rewarding experience. I wouldn't change anything. I have loved every minute of my career. I still have a long time to work, so looking forward to see what happens in the future. But you cannot go wrong with health sciences. So always love to talk to students, prospective students, families. So come visit us anytime. We have a beautiful facility that we always love to showcase.
Well, we're going to we didn't even get to talk about the facility. We'll have to have you on again just to be able to do that. Well, thank you, Dr. Arnold. As this episode comes to a close, conversations like the one we just had is a reminder that preparing students for careers, particularly in healthcare, is far more than the content or credentials. It's about developing professionals who can think clearly, respond under pressure, communicate effectively, and carry the responsibilities that come with caring for others. That kind of preparation doesn't happen in a single class or a single moment. It happens over time through coursework, clinical experiences, research, mentoring from faculty and staff, and the expectations placed on students to grow into the roles they're stepping towards. And that's the work that's happening every day across the College of Health Sciences, as we've learned here today at Gardner-Webb. So again, Dr. Arnold, thank you for joining the podcast and for your leadership and for the way you're helping shape that experience for our students.
Thank you for having me.
And to our listeners, thank you for spending part of your day with us. If you enjoyed this episode, be sure to follow the Bulldog Mindset wherever you listen to podcasts. And you can always learn more about Gardner-Webb University, our programs, those in the College of Health Sciences, and many others, and the opportunities that we've discussed by visiting gardner-webb.edu. And of course, a big thank you to our producer, Noel Manning, who makes this sound smooth, seamless, like we knew what we're doing the whole time. Until next time, keep showing up, keep doing the work, and keep preparing for what comes next. That's the Bulldog Mindset.